بسم الله الرحمن الرحيم والصلاة والسلام على رسول الله صلى الله عليه وسلم. أهلا وسهلا بحضراتكم, ladies and gentlemen, brothers and sisters at the ISB and ISBCC community voice. Welcome to this episode. Still, we're talking about the same topic, which is COVID, and now we have a hope and we have the vaccine. So there's a big debate about the vaccine. I know that the push into let's get it, let's get this done, and let's get back to our normal life. And while we're talking about that, all of a sudden, we're hit with another surge. We don't know what this surge is carrying for us for the next couple of months. Some politicians are saying that too many challenges is ahead of us. So will the vaccine solve these challenges that's ahead of us or not? We don't know. Is it the only chance, our only chance? We need to know that. Is it a mandate to take it? Do we have the option of not taking the vaccine? So all this stuff, we need to know the reality behind this vaccine Pfizer, vaccine Moderna. Are there any other companies that are going to do this vaccine? Are we expecting different kinds of vaccination? So we thought of getting our guest today, someone who tried, administered the vaccine, and been on the front line since last March. I've witnessed a lot, seen a lot, treated patients a lot, and have extensive experience in dealing with this disease and this virus. And recently, there is like a sigh of relief in his face with this vaccine. So with that being said, I would like to welcome my guest today. My guest, Dr. Khaled Eissa, is an MD, graduated from Cairo University and received a training in pulmonary and critical care medicine at Tulane University, New Orleans, Louisiana, and youth critical care training at the University of Texas. He's a board-certified pulmonary and critical care medicine. And right now, he's the chief pulmonary and critical care at Good Samaritan Medical Center. Assalamu alaikum, Dr. Khaled. Thank you for being with us today to shed some light on what's going on with the vaccine. And I know that, as I mentioned in my introduction, you've been there at the front line from the beginning till, I wouldn't say the end, but till now, at least till now. You've witnessed a lot. I shared with you, you shared with us like a different setup in the South, what's going on, and the different treatment that has been changed, and the stuff that you as a team, you and your team are doing an excellent job. So before jumping into the vaccine, I'd like to ask you, walk us through the evolution, I would say the evolution from March till now. What you've witnessed from the beginning up till now. Patients, size, surges, treatments, experience in the treatment or the protocols. Just like a timeline so that we can start talking about the vaccine.
Yeah. Assalamu alaikum, Dr. Ahmed. Thank you so much for hosting me. The answer for this question, I can keep talking for hours. However, I'm going to try to summarize it. Initially, when this came up in China, no one thought that this will come to us, to our home. And I remember very well the first case that was diagnosed in Massachusetts, and we thought, oh, this is very close now. When the first case that was diagnosed in Massachusetts, and then very quickly the situation evolved very rapidly, and no one was prepared for it on any level. No one was prepared for what happened in April and in the spring. Huge number of cases filling up with the hospitals in our hospital and many other hospitals around the state. We had one ICU and we had to open an additional intensive care unit to host the patients there. We had no treatment for it. No one knew what's the right treatment. We were trying different things on different patient we were working based on different people experience, based on recommendation from China, based on some recommendation from Italy, small study here, small study there, and gradually the situation evolved. The spike or the surge that we had in April had a very quick uptrend and then very quickly dropped. By end of May, beginning of June, things were much better by that time, alhamdulillah. A lot of people died. I have never seen, I work in the ICU and I always see people dying. I'm very used to it. However, the number and the rate that I've seen people dying in April and May was outstanding. It made in my own eyes, it made life look very cheap. It made me see how weak we are. It's not just dying, it's patients suffer a lot before dying. They die alone. in a room on the ventilator, their families are not next to them. Pretty much what we could do then is pick up an iPad and or a tablet and let their family see them through the camera, and that was it. That was the goodbye. It was a horrible situation. Alhamdulillah, things improved by the end of the spring, and then we came to the summer. Things were great in the summer, very few cases. I just want to tell you that our hospital in May and in the spring was all filled. Every single patient was COVID. We actually had to put the non-COVID patient in a small unit, isolated in the hospital, because the rest of the hospital was COVID. By the end of the spring, I think things will start to improve and life was getting back to normal. The hospital started, taking care of other patients as well. August and July were great, 0 to 1 cases actually in the hospital, but then definitely by October you start seeing the uptrend again. This one, the uptrend is slower. It's hitting us slower, but it's definitely, there's a definitely very clear uptrend. Now, do I see different patients? Do I see a different virus? Do our patients, what's different this time? Now, one thing I definitely agree that the mortality is less. And that's for different reasons. I'm not sure if this is what you want me to talk about right now, but definitely the mortality is much less than before.
Why?
Why? That's a good question. So first of all, a big factor, I think we're diagnosing it way more. We're doing massive number of tests in the United States, and if you go to the Massachusetts website, these information are public, by the way, how many tests is being done every day. We're doing a big number of tests every single day. So you're diagnosing more, right? Everyone, people traveling, getting.
So diagnosing mean that the base of the people with the disease will be increasing. The numbers are increasing, but the mortality rate is less. This has to do something with the treatment or the social distancing, or why is the mortality rate is less with the second surge or let me say right now? Why is that?
No, so that's why. So there's a thing that we call case fatality rate. It means how, if for 100 cases, or 1,000 cases, how many people are dying. This is what we use, and because we have so many cases, it makes look like the people that dying from it are less, because you're looking at the percentage. So when the total number of cases are much bigger, you're diagnosing a lot more asymptomatic cases or very mild symptoms. Now that makes you look, your mortality is less. I want to give you an example. I remember the very few cases we had in the hospital. For us to get a COVID test, we had to go to the Department of Public Health and wait for them to authorize a test for a patient, very sick patient in the ICU, wait for a week to 10 days to get the results. You can imagine the difference now we have from then. But that's only one factor, to be honest. I think the other factor that the hospitals are less overwhelmed and much more well prepared to handle these cases in terms of protective equipment, etc., etc. Third, I think definitely our treatment as physicians, as healthcare providers, is much better than before. We know what to deal with. We have much more better done studies and research in managing these cases. Particularly the outstanding, I think personally, and not just personally, I think also statistically, I think one of the most significant things that made a difference in our treatment is started to use anti-inflammatory treatments such as steroids, which initially when the disease first came up, it was actually not recommended to use steroids, and now it's more recommended. Actually, it's definitely showing a benefit to use steroids. Now, are the patients younger? Yes, the patients are younger. But is it true? Is it because COVID now is affecting younger people? That's hard to say, because I don't think we were doing too many tests at the beginning. But definitely, if you go to the Mass website, you will see that there is definitely an age difference from the beginning. You have more younger patients now coming in or being diagnosed with COVID.
That's interesting. So I would like to go back to reflect on what you're saying. That in the beginning, like your eyes, like patients are passing away alone without even seeing their loved ones, and this is a very sad moment. What we were thinking at that time, you personally, although like you're treating something that's not known, no one knows how to beat this beast, and people are dying while people outside say that this is not real, this is not reality. So personally, where's the line of hope for people like you and your coworkers, your colleagues? Yeah, were you thinking at that time of a vaccine will come up, or like, what is the end? What is the light at the end of the tunnel for you and your colleagues?
Yeah, it was horrible. I'm telling you, I swear, nurses, physician were going home crying in their cars. We had counseling sessions. Definitely, it was all virtual, like virtual counseling sessions to the medical staff. Um, it was hard. It was very hard, and people were frustrated. You see the patient getting worse in front of you, and you just cannot do anything. Should I put them in the ventilator? Should I not put them in the ventilator? It was every single day was very difficult decision being made for patients. I mean, one of the most hard things was putting patients in the ventilator, because most likely the patient that you, I mean, I don't want to scare people, but it's a lot of times when we put patients in the ventilator, they never, it's very hard for them to get off the ventilator.
Mm.
We were faced with these challenges day and night. The nurses, the medical staff, everyone in the hospital burned out during these few weeks. A vaccine at that point in March or April looked like a dream. People were talking about the vaccine. I was saying, it's so long before we get to the vaccine point, not before 2021.
Yeah.
Did I see the end of the tunnel then? I only started seeing the end of the tunnel for me at that point. The end of the tunnel when I started seeing the cases going down, which was in May. And for me, the end of the tunnel was with about July or August. I was so happy that we're beyond this. I was hoping that, okay, now we have masks, we have protective equipment. Hopefully, we're not going to get into another situation like we did in April. But here we are. I think we're very similar to what happened then.
So awesome. And right now, I would say that thank God, Alhamdulillah, Rabbil Alameen, we do have a vaccine. Actually, not just one vaccine from one company. We have two vaccines. I don't know whether you know about something else in the pipeline that's coming or not. And I know that you personally posted something that you took the vaccine, you and your colleagues. So I'd like to talk about this experience. Were you afraid, like, to take the vaccine? With all what's going, and what did you feel about it, like, and what's your advice for the people who did not or are not willing? So let me tell. So what's the some of the I would say, like, if there is any side effects that you been exposed to after taking the vaccine?
Okay. It was an easy decision for me, alhamdulillah. I still made istikhara. Just to let you know, I made istikhara that night before I took it. I looked at the study. Well, for me, alhamdulillah, I'm healthy. I have no major problems. The risk of dying from COVID was low, very low. It's probably few patients in my age and my condition in 1,000 will die from COVID. Although I've seen people in the patients in the 30s dying from COVID. But even though if it's a few in 1,000, compare this to a study on a vaccine that during the time I got the vaccine, it was only Pfizer. 20,000 people got it and they did okay. For me, this was an easy decision to make. Nothing in this life and is 100% guaranteed. Even in medicine, any intervention you do in medicine, there is a possible potential side effects. But for me, and that's why we always weigh the benefits and the risk. But to take that vaccine, it was very obvious. There's some chance of dying from COVID, not just dying from COVID. Even if I get the COVID and I don't die, a lot of people end up with lingering symptoms for weeks and months afterwards. You talk to people, say, I still feel, I don't feel right. My brain is not working right. I still feel weak. I still feel fatigued. This is actually well documented in medical research. We don't know why exactly it happens, but definitely it happens. Why would I take that risk and wouldn't take a risk of a vaccine that was tested on 20,000 people that received it? And just to let you know that the study for Pfizer had 40,000 patients in it. About 40,000, 20 had the vaccine and 20 had the placebo, which was pretty much salt water. So for me, it was a very easy decision to make, alhamdulillah. And that's why I went ahead and took the vaccine. I want to let you know that when I received the vaccine, actually, I wasn't on the top of the list for the hospital because I'm younger than other physicians. But on the day, I think they were able to administer to most of the other staff with higher risk factors. But because when the Pfizer vaccine has a special way of treating it, once you thaw it, you have to administer it within a certain number of hours. So they had few doses left, and they said on the very first day, if someone can come down and get the dose, they can come and take it. And I ran downstairs and I took the dose right away on the very first day they'd being admitted in the hospital. Did I get any
awesome.
did I get any side
Yeah.
effects? Well, my arm a little bit sore the next day when I lift my shoulder up. That's pretty much it. 1 or 2 days, it was gone. I didn't even have to take Tylenol. I didn't take ibuprofen. It was gone. But just to be clear, that the side effects are more common after the second dose, and pretty much is expected, because now your body, when you receive the second dose, your body will actually have a stronger immune response because it learned something from the first dose. It learned to identify this foreign material. So when it gets exposed to it again in the second dose, it will have a stronger response to it. So side effects are expected, but they're all manageable. And these side effects are very common after most of the vaccines we get. I personally, when I get the flu shot, for the next day, I'm probably tired and maybe have a low-grade fever. So I was okay with it. It's expected, and it's very manageable. If you look at the study that done, showed a very low risk of side effects, major side effects.
Alhamdulillah, perfect, Khaled. So, what is the duration between the first dose and the second booster dose left? How long you have to wait till you get the second one?
21 days for the Pfizer and 28 days for the Moderna. But I think there is some grace period. I don't remember. I think there is a grace period for like maybe plus or minus few days on each one of them. But it's 21 days for the Pfizer and 28 days for the Moderna. They're very strict right now with between both doses. But I think they will. They probably become more lenient as you go, because maybe a patient cannot show up or something. So I think there's some grace period, but it's 21 days for the Pfizer, 28 days for the Moderna. And just to let you know that even the Pfizer vaccine, if you look at the study, the effects start showing up even after the first dose.
Interesting. So now this vaccine, we heard about like there's a different strains of this coronavirus that has emerged out of the UK, or potentially different characteristics with potentially different characteristics. So would this vaccine covers all the strains, or like certain types that we know about, and there will be another vaccines that will take care of the other strains, or how this works?
Okay. So I just want to tell you, and I learned this from my friend, Professor Islam Hussein, who's a virologist. This should not really be called a strain, what's happening in UK. It should be called a variant of the virus. You call it a strain when you have a major change in the genetics of the virus that resulted in a major change in the behavior. That's what you call a strain. So COVID-19 is a strain, or the SARS-CoV-2, that's a strain. But whatever we have in UK still falls under the variant term. I would say it seems to be causing very similar illness to what's happening before. So nothing major change in the way it affects the patients. What's special about it is that it has many more mutation or changes in the genes than the other variants that are available. And to explain, there already have been many variants of the COVID vaccine. In different regions of the world, you will have different variants more common than others. This one particularly is more in the UK, is spreading faster in the UK. It has more mutations than other of the variants available. Now, there is some of the changes, and here's a tricky part, I think, and that's why people focus on the vaccine. It's about the spike protein. This protein is on the surface of the virus. This is what allows the virus to invade our cells. And that's actually what the Pfizer vaccine and Moderna vaccine, that's what they use to induce immunity. So basically it exposes your body to that spike protein, so your body can make antibodies against that spike protein. Now, people are afraid, or basically the concern is that the changes or the mutations in the gene and the change in the spike protein may make it able to escape the immune system for vaccinated people, or people who had COVID infection before in the past. Now, do we know this for a fact? No, we don't. It's a theoretical concern, and so far there has been no confirmation that this can happen actually. The body makes actually a lot, I mean, significant, I mean, it's not just one antibody that our body generates when we get infection. It's more than different antibody that our body generates. So no, I think the expectation that the vaccine will cover it, it's not for sure information, though. I think this has to be looked into more and studied more by the medical community.
Perfect. So, Dr. Khaled, right now, if I go to any hospital in the United States, would I take the same protocol? It is like a unified protocol to know how to treat the COVID right now as a patient in different age groups, or no, it's like an experience based on the center and the type of the COVID patient they are seeing.
It's basically there are current standards in the United States. I think the current standard is most of the patients receive remdesivir and steroids, pretty much dexamethasone. Now there are differences in treatment from different places based on different experience. There are still a lot of experimental drugs being used. And actually, there are some other, there is one medication recently received FDA authorization for being used in COVID vaccines as well. It's also it works the same way as anti-inflammatory. So there will be some slight differences, but I think the backbone of your treatment you will get as a COVID patient, inshallah you will not get it, but anyone gets to the hospital with a COVID-19 will pretty much receive remdesivir and steroids. However, there may be some slight differences between different centers, especially when you go to academic centers where they do research trials. They may be involved in a trial then.
Awesome. What about the loss of sensations, loss of taste? There's any medication for that?
I don't think so. I don't think almost everyone I know that had it went away. It's just a matter of time. I don't think so. The COVID vaccine affects our neurological system in a funny way. We're still not really able to characterize exactly what happens. But almost everyone I know that had this issue, it went away. The taste and smell came back gradually. People actually may underestimate it, but when someone have it, when you ask them, you said they couldn't eat anything. It was so hard for them to eat or drink.
Yeah, this is very painful. Awesome. So now let's take another shift in the next couple of minutes till we end up. So right now there is a new rules and regulations being issued by the governor of Massachusetts, saying that let's go back to the capacity 25% and stuff like that. I know that we as like people living in the South and we as Muslims, our facilities and worship and masajid will be affected with that, especially like the Friday prayers and stuff like that. Although like we are taking precautions, we are wearing the masks and we do the sanitizations, we keep the social distancing. Having said that, still we are not able to go to our masajid and practice, or like very limited numbers go, or like I see that there's different rounds. So is this going to last longer, or is life going to be back to normal with the vaccine, or this is the new norm and we have to get acquainted to it?
It's very hard to answer a question. I think inshallah life will go back to normal. I mean, there have been many pandemics through the history. Life always end up going back to normal. How long will it take? I don't know. This surge seems to be going to be there for a while, especially being in the winter and being indoors. I think, and now we have a couple of holidays coming that just came out from Thanksgiving and then Christmas, and a lot of people traveling. I think we're right now in I don't know even when we're going to peak. We haven't peaked yet. This surge, numbers are still getting higher and higher. So
Doctor,
I know the surge will be over. The vaccine, that's what, right?
Yeah, we have a question. Say that by Karim Said said there's a difference in efficiency between Pfizer and Moderna vaccine. Is there anything in the clinical trial that said that?
I don't think so. I think pretty much about the same. Very slight difference in number, which is probably just by chance it happened. They work actually the same way. They based on the same concept, maybe just different way in the preparation and the administration. But they both based on what called you probably heard about this from the last session, the mRNA vaccine. mRNA-based vaccine, which makes your body produce protein similar to the spike protein in the virus. They both work the same way. So I'm not really expecting a difference. And to be honest, at least in the very few months, no one will have the luxury to choose which vaccine to receive.
Is it going to be mandatory or like by choices?
I don't think it's going to be mandatory. Even in the hospitals, it's not mandatory. Whoever willing to get it, they get it. It's still a lot of people skeptical. I gotta tell you, but to be honest, a lot of people receive the vaccine in our hospital, and they all, alhamdulillah, they're doing fine. They're doing well.
We have a question from Ihab Murad. Say that how long do you think it will take to have everyone vaccinated and things go back to normal? I think this ties back to the question that I asked him. So
Yes.
protection, is it like 2021?
Yeah, so the state plan, hopefully that all the groups will receive the vaccines by the spring. The spring, everyone who wants a vaccine should have received it by then. Now, there is a couple of points to clarify that we have that we don't have answers for. Now, that the vaccine prevent asymptomatic infection, like if you get the vaccine and you get the virus, can you still transmit the virus to others, carry the virus and transmit to others, even if you don't have symptoms? The study did not answer the question. The studies we have do not answer this question. So I think our hope is that we will get the vaccine, that everyone receives a vaccine, the number of cases will go down, and gradually you will go back to normal life. The concern is that there will be a lot of people that will still be skeptical about the vaccine, but I'm hoping, inshallah, as more and more people get it, more and more people will be encouraged to get it. I will definitely give it to my family. Please get the vaccine, especially if you have risk factors, older age risk factors, diabetes, hypertension, obesity. Please get the vaccine.
Awesome. Thank you very much for passing by. Dr. Yusuf, say how long it may take before the vaccine start providing protection?
To be honest, even after the first dose, after a few days, your body will have already generated immune response, and then you should have some protection after the first dose. But to have the best effect, it's 7 days, and that's what the study looked at. It's 7 days after the second dose.
7 days after the second dose, and we have to wait 21 days to have the second dose. So it means that 28 days from the first dose, you can say that you are protected.
You can say that you have the protection, but this doesn't take away the mask, though. The mask will be there for a while.
Mask, social distancing will be like our bodies for a while.
I think so. I don't have a timeline, to be honest, but it's kind of similar to what, I think we were doing very good killing it to the summer. We were able to do masks and social distance, but it seems like we got into the winter, people dropped off their guard a little bit, people became tired. So the number of cases are going back up again.
Dr. Khaled, thank you very much for this very interesting conversation. I really appreciate your time and your knowledge and giving us some deep insights. May Allah protect you and protect all your colleagues.